hostels, you've been given lockers. Some of these things has to be locked in your lockers, especially when you are moving out of the room. And for that matter, the hostel. And we also encourage you to use approved routes on campus. When you enter this university, you see a lot of routes on campus. Some are approved ones where we have our men in uniform detailed to ensure your safety and then security. That notwithstanding, there are other unapproved routes around campus, and most students always want to use such routes. And there is a saying, I think, in a camp parlance, they say, "Kwantia eyemusuo." Everyone wants to use a shortcut. And those shortcuts often lead us into problems. So I will encourage you to use approved routes. And if I'm talking about approved routes, I'm talking about 3 identified approved routes. We have the main entrance. If you are entering the university, we have the main entrance. And we have another entrance leading you to the University Hall 1. We call it the hostel barrier. And we have another one close to the RC's complex, also leading you to the stretch along Vinco, this stretch of road. It's called the Sawmill Out route. So these are the approved routes where we have our men in uniform there to provide security for our students. So let's take note of that. I encourage you to avoid any criminal activities that will land you into problems. And in this university, we have some offenses that are punished and is enshrined in the university regulation. One of them is not to steal, destroy, or damage any university property. Another one is transfer of university property to your private hostels or in your custody. It's also an offense. And then another one is sexual abuse. Sexual abuse and then rape. All these things are offenses enshrined in the university regulation that are punishable. And also, one of the most important one is production and distribution of pornographic materials on campus. It's against the law of the university and the nation at large. So let's take note of that. And again, there are other serious offenses that are state. And there are 3 here. One is rape, murder, and the possession of drug or other illicit drugs. I want to end my presentation by saying that the University Security Services is ready to support you and assist you in any security challenges that you may encounter. But as I said earlier, security is a shared responsibility. You have your part to play. We also have our part to play. So let's do well to adhere to these security protocols. On behalf of my head of department and the head of operations and administration, I would like to welcome you once again to the University of Energy and Natural Resources, and we pledge our full support in ensuring your security and safety whilst on campus. Thank you very much for your attention. Thank you.
Thank you very much, Security Services Department. The Director for Health Services, so he wants to do his presentation and leave.
Good afternoon, ladies and gentlemen. On behalf of the University of Streets, I welcome all of you to Juné. Ladies and gentlemen, it's a fact that for you to go through your academic work successfully, you have to be in a very good state of health. When we say good state of health, we are talking about physical, mental, and social well-being. Not just the absence of disease, but you should be physically fit, mentally sound, and socially sound. And so, the University Health Services exist to provide you quality health care to enable you go through your academic work successfully. So, when you fall sick, health insurance card, it was stated in your admission letter that you must come with a valid national health insurance card so that when you fall sick, you can access health care at the university clinic. It may not end there because the service that we provide there is primary health care. The great service that we provide is primary health care. And so there'll be a need for us to refer you if the need arises. Maybe you come with a complaint and that you need surgical intervention. It means that we have to refer you to a higher facility. If you go to that higher facility and you don't have health insurance, you are going to pay for the services they render to you. And so we are going to make provisions for you so that the National Health Insurance Authority officials will come. And those of you who don't have an active health insurance card, you have the opportunity to register and get one so that when you fall sick, you come to the clinic. See you free. And with the preventive health care, we have our nurses who can take you through health education, immunization, anything about preventive health care, nutritional advice and everything. You can come to the clinic and you can have such services rendered to you. One very important exercise that's going to be carried out is a mandatory health screening for all first year students on admission who have been admitted. We're going to get you the dates for very soon, get the date for the exercise. Please, it is mandatory. It's part of your admission requirements. So you cannot skip it. If you skip it, there's a consequence. Because, one, some of you may be having certain health challenges that's going to impact negatively on your life on campus here and your studies as well. And so we must identify such people, and then we recommend to management what is supposed to be done for you to make life comfortable for you. Some have certain diseases that are very contagious. Okay? Looking at our numbers, if someone has tuberculosis, okay, can really spread such an infection to all the university members of the university community. And so we must identify such people and treat. It also helps us to look at the trend of disease on campus so that we can put up preventive measures to help prevent its spread. And so it's a compulsory exercise. Please, everybody should make he or himself available for the exercise. We will send the timetable for the exercise through the Dean of Students to all of you. We say prevention is better than what? Cure. HIV is still with us. We all know what HIV is. It's still with us. And I know you've been taught, or you've read about how one can contract the infection. And so, please, you are an adult population and very sexually active. Okay, so what our advice is that the first thing should be what? Abstinence. Okay, the best thing is to abstain from premarital or whatever sex you can say premarital. So, if you can't, the B is what? You have to be faithful to your partner. we can prevent you from entering into relationship. I think some of you have your husbands and wives from here. Okay, so if you can't abstain, what you have to do is to be very faithful to your partner. You don't go about hitting around and then you contract the infection and come and infect an innocent person. We've had series of some of these things happening. And so we know what we are talking about. Very innocent. The chap doesn't know anything. He comes to meet you, enter the relationship with you, and because of your bad sexual habits, you infect the person with the virus. And so, if you can't be faithful to your partner, then the use of what? Condoms. All right? If you come to our clinic, look for me confidentially. We'll sit down, and then look for me confidentially. We'll sit down, and then we'll make sure that you get your constant supply of your antiretroviral medication. Likewise, if you have any other chronic disease like hypertension or diabetes, please come to the clinic. Let us know you, and we'll make sure that you always get a regular supply of your drug so that you don't default. But if you default in treatment, it comes with a lot of complications. So that is it. And so, as students, you need your brains have to be intact for you to learn. You need your brain. Everything that you learn will go into your brain. And then a time will come, you have to reproduce it. And so your brain must be intact. Henceforth, I advise you to abstain from any performance enhancing medication like Indian hemp, the use of Indian hemp, the use of tramadol, cocaine, and the rest. Okay? These are medications that will destroy your brain cells. Okay? I know some of you have seen addicts, the way they behave. They are almost useless. That's what I would say. Their brain is shut down. And if you want to combine this with learning, I bet you your stay on campus will not be fine with you. So please, those of you who are already in it, I would advise that if there's any difficulty, if there's any difficulty in getting out of it, please, you can come to us. We'll take you through the process so that you'll be able to, stop using those medications, those drugs. And for those of you who don't know how to use it at all, please, I advise that don't attempt it. Alcoholism, smoking, any form of smoking, all right, shisha, whatever it is, all are drugs that or medications or substances that will go to destroy your brain cells and then make you stupid. Okay? So please make sure that you abstain from all these things, and then you'll be okay. And also, as students, you should mind what you take in as food. Okay? Make sure that you eat more of vegetables. Okay? Less fatty diets. I know because of time, the most available food will be your fried rice and that kind of thing, and your the Indomie. All right. I'm not saying it's bad, but please, that shouldn't be your daily diet. It has high energy cholesterol levels that can raise your blood cholesterol levels high, and its attendant complications. So please, more vegetables. Please do exercise as well. Okay, exercise has been proven to, make the brain sharp. It sharpens the brain. Okay, you excrete waste products through exercise. Okay, so please exercise. Take time off and exercise. Sleep is very, very important. Okay, sleep is very, very important. One thing about we students is that when school reopens, when we come to school, instead of day one after lectures, we sit down and then go through what we learned. We pile everything up. When we get to exams, that's why we want to read everything from first semester to whatever semester it is. That brings a lot of pressure on you. We've been recording high cases of, stress-related issues when it comes to during exam time at the clinic. You see, when it's time for you to do the exams, that's where revision week, that's where we want to learn everything that was taught the first semester, one kind, you didn't read it, all right? You pile everything up, 2 weeks to exams, you want to sit down, and then put everything to the brain. The brain cannot, you pile up your notes, and when it gets to exam, you want to read it, and some of the things become very new to you, okay? That will not help. The brain cannot contain that much at a time. So please, it should be gradual. Start from now, okay? Gradually, then it stains. You are young, your brain is fresh, so you can. It's not like some of us. We are old, but through listen for you people, you can absorb. So I advise that you don't put that much stress on you. Please have time to sleep, drink a lot of water, and exercise. Okay, that is preventive healthcare. If you do this, you will not fall sick frequently, so that you can have a healthy stay on campus. Thank you very much for your audience.
That's Dr. Solomon Fofie, is the director of the University Health Services Directorate. So when you go there, you see him there in his tie, always in tie. Very nice man. So as I said, the medicals is mandatory. If you don't do medicals, please don't consider yourself as a student, because it will be in your file. Everybody's medical record will be filed. A file will be opened for every admitted student or every enrolled student. Every student that has enrolled, a file will be opened for you. And if your medical records are not seen in your file, you cannot even graduate. So please, the date for the medical screening exercise will be communicated through the Dean of Students office, which I know will be very soon. And it will be done here in this very auditorium. So the modalities will be rolled out. I'm told Hall 2, they have a table there and they are still registering. So if you are in Hall, if you are affiliated to Hall 2 and you are yet to register, please, when we are done, you go behind the building and register. Hall 2. I'm also being informed that the Dean of Students office is taking attendance. It appears the first session we witnessed over 5,000 students. By the second session, I think we are less than 3,000. So the Dean of Students office is taking attendance. All those who failed to come for the second session, please, very soon we'll write to you to explain to us why you failed to attend orientation. And write long essays with 2,000 words why we should keep you as a student of UNER, or why you shouldn't go home, why we should keep you here. So tell your friends who failed to come for the second session that tomorrow we will take the attendance, both morning and afternoon. And after the whole week, when we with orientation, you will hear from us. You know, when we were in school, registration was manual. You would have to wake up about 5 a.m., sometimes about 4 a.m. to go and queue just to register. But now registration has been made simple. Everything is by the computer. If you have a very good If you have a very good phone, you can even use your phone to register all your courses. The IT Directorate is here, and they will take us through a presentation on how to access ICT facilities on campus. With a round of applause, let's invite Mr. Akon from the ICT Directorate.
Hello. Hello. I need your attention, please. Your rapt attention. All those outside, please come inside, please. Those outside. Okay, so as my able senior said, I'm Mr. Akon, and I bring you greetings from the IT Directorate and my director, Mr. Daniel Benfo. I'm here to orient you on what to expect from the IT Directorate. So every student here, once you are, hello? So after your matriculation, once the system pulls you into the system and you become a full student of University of Energy and Natural Resources, you shall receive an email with your credentials to the university portal. And the link to that portal is sis.uner.edu.gh. sis.uner.edu.gh. That is the link to the portal. Practically, you can access it from the portal when it comes to your academics and IT related stuff. So from the portal, the first thing that you need to do once you have your credentials and you access the portal is to update your information in the portal. Over the years, we've realized that most of you during your application use the cafes. And the cafe attendants usually use their credentials, their phone numbers, and emails. Communication to you shall be through those numbers you provided. So if you provided a wrong email, or if a cafe attendant used his or her email when filling your form, that will be the address or the contact your data will be sent to when any information is being sent. So please, when you get your credentials, first thing you do, update your records. Update your email, update your contact. What we realize is students have challenges with their credentials after resetting them after their initial entry into the portal. They usually forget their passwords. And they troop to the IT Directorate asking for passwords to be changed or trying to retrieve their passwords from us. We don't know your passwords. All passwords in our system are hashed. We can't retrieve passwords for you. So the system has a mechanism that allows you to reset your password. It is right under the login screen. You click on that reset password link and follow the procedure. Very simple. An email will be sent to the email in your system, like in the system, the record we have. And that is from that email, further instructions will be given to you to reset your password. It's very important. We will then move on to registration. So when the portal is open, when you have access to your systems, as a student, first thing you do after updating your records and all is to ensure that you are registered. You know, if you are not registered, you are not considered to be currently present. And without registration, you can't sit for any exams. Without registration, you are not even considered as a student yet for that academic year, that semester. So with the registration, once you log in, you expand the hamburger icon on the upper left corner. Then you click on registration. Once you click there, you will see all the courses you are supposed to register for. The core ones, the mandatory ones already checked in green. That doesn't mean you are registered. Most students confuse that to mean they have registered. No. When you click on the register button and it takes you to that page. Click on the save button at the upper left corner. You click on the save button on the upper left corner. Unfortunately, we don't have the projector here. We would have taken you through, but it's very intuitive, very simple. Once you click on it, you get a message indicating your status. Ensure that the registration is successful by checking the current status of each of the courses. You would see pending. Pending means your registration from your side has gone through, awaiting your HOD's approval. Once that is done, you are done with the registration. Very simple. Then again, after the registration, after you go through your academic studies, you write your exams, results are uploaded. You need to see your results. During our days, usually they will paste it on the notice board and you have to come to campus to come and check your results, whether you passed or you failed. But now from the comfort of your home, wherever you are, you can check from your portal and see your results. Same procedure. You log into the portal, expand the hamburger icon, click on results, and you see all the results there for every semester you've registered for and taken your exams.